before we take a closer look at the problem of shortage of physicians, let's first take a look at healthcare around the world. How much of the world population really has access to healthcare services, and what regions are suffering the most, and what kind of an impact is it having?
In some parts of the world, a person dying from a preventable disease and treatable disease like malaria, for example, could be unheard of, and it could be very uncommon to hear of a woman dying as a result of childbirth. However, in many other parts of the world, these are normal occurrences. People die all the time from diseases that could be prevented, treated and even cured. The major reasons for this situation are lack of access to healthcare and not enough properly trained healthcare professionals. Offering quality, affordable healthcare is a dilemma to many nations. According to the World Health Organization, around 1.3 billion people around the world don't have access to the most basic healthcare facilities. Not only is there a shortage of health workers, but health services are also often unequally distributed. Brain drain from poorer nations to wealthier ones is making the situation worse. Developed countries are willing to recruit foreign experts at a much higher pay to fill in their own shortages. This outward immigration of health workers from poorer countries means that those regions that require the most attention end up having the lowest quality care or none at all, with rural communities being the most affected.
Tonight we're speaking with Dr. Lalit Chandradasa, a physician who is an advocate for opening up more avenues for students to pursue a medical career than our current university system permits, which he says will help fulfill the shortage of doctors in the country. In this first segment, we talk about some of the reasons for this shortage of physicians in many parts of the world. Dr. Chandradasa, thank you very much for joining us here on Global Perspectives and giving us your time. As you know, we're talking about healthcare issue on this particular episode, particularly the shortage of physicians, not only here in Sri Lanka but around the world as well. In the States, they have been talking about this recently. In India, maybe African countries as well, healthcare professionals are in demand and you don't have enough is what the message is. Can you help us understand some of the factors that come to play with the shortage of physicians particularly?
Well, basically, it's not easy to be a doctor. Being a doctor is it's very depressing. Most of the time, you have to hear the sad part of life, and also you have to undergo a lot of training. I mean, especially the youth today, they are in a very fast mode of life, so they don't have time. To become a doctor, you have to spend about the best part of your life studying the subject. And also in the West, there is litigations. So, and you have to be at it. If you are a doctor, you can't just relax. So I think because of those things, though the economic returns are good, people are reluctant to get into this profession.
But, I mean, very much in Asia, but even so in certain other countries, doctors are looked upon as these almost, godlike beings, who have all this power to heal. And people aspire to be that, not only for financial reasons, but for doing good for the society. So do you see that trend changing? Is that what you're saying?
Of course, especially in Asian countries. It is a way to make money. Our societies are changing. But having said that, even our training doesn't bring in the human aspects of medicine. It is not inculcated in the students that you have to be nice to patients, you have to talk to them nice, you have to understand their problem. But unfortunately, for some reason in our parts of the world, this part is not thought or given much importance. So maybe that is one reason again why the West people don't want to become doctors, because there's a lot of responsibility. See, it's you always deal with a life, and that's a huge responsibility to be in charge of someone else's life.
Can you give us some stats as to, even in Sri Lanka and other countries as well, about the shortage? How severe is it?
Okay, if you take the West or America for that instance, today the ratio between the one doctor has to provide services to 400 persons in the population. But ideal, they say, in a country like America, it's about 200 patients per doctor.
Realistically, you mean?
Yes. Okay. Which even is difficult for them to achieve. Say the WHO recommends that there should be about anything between 500 to 750
that we can't even come close to this average that it should be. Or are there other reasons that factor in?
Not the only reason. You see, economic reasons. Now, for a year in Sri Lanka, we produce 1,100 doctors. That's the maximum we can produce. Because we have only state universities. Right. But say, for instance, in India, 50% of the medical schools are private medical schools. But here in our country, we don't have enough funds to be given to universities to produce doctors. At the same time, we are for some reason reluctant to accept the private sector producing doctors, which is very, very common in the Western world. As I told you, India, 50% of medical schools. Then even in China today, there are private medical schools. America, I don't have to tell you about America and UK. Most of the schools are private. So the other thing I think there is an answer to your question before. Becoming a doctor is very costly also. You see, in America, you have to spend about $38,000 per year. Whereas we don't pay a cent to the government.
And it's much longer there too.
Much, yes. So I suppose those are the reasons.
So you are advocating private medical schools in this country. You think it would be good for us?
It would be good, but at the same time, I would say the standard should be maintained.
Right. I think that's the biggest concern of those who oppose it, right?
Exactly.
Right.
Exactly.
How do you think, how do you reach that how do you bridge that gap, making sure the standards are high as well as giving more opportunities to meet this requirement?
Right. Now, again, if I go to the West, there are strict regulatory mechanisms. Universities, though they are privately owned, there is a regulatory mechanism which controls the quality. Say, and also the professions are also geared. They have their own professional bodies who will see to it that the quality is maintained. But unfortunately, when it comes to our part of the world, like anyway, with anything else, our regulatory mechanisms are not that powerful. They are not robust, and they are to an extent corrupt. Say, for instance, the local medical council, Sri Lanka Medical Council, which is supposed to be the body which regulates the behavior of doctors. I would say it's like it's again controlled, dominated by a group of trade unionists. So for them, their trade unionism comes above the quality.
According to the World Health Organization, nearly 60 countries around the world are experiencing what it calls a critical deficit in the healthcare workforce. As with many other development indicators, countries that have the greatest need, mostly developing countries, are the ones that are suffering the most, with inadequate numbers of healthcare professionals. In this next report, we take a closer look at the shortage of physicians specifically, how bad the problem is worldwide, and the extent of the problem here in Sri Lanka.
The field of medicine is a sector that has always benefited from new technologies. New discoveries and inventions in medicine are helping people live longer and healthier lives. This is probably true if you live in a developed country or an urban center. But for many people around the world who live in poor countries and communities, the access to even the most basic facilities or a visit to the doctor is a rare opportunity, simply because there aren't enough doctors to meet the need. One of the most extensive studies of the global health workforce was conducted by the World Health Organization in 2006. The study took a look at all the different career stages of health workers and proposed a 10-year plan for countries to rebuild their healthcare workforces. One of the most significant findings was the fact that there was a global shortage of nearly 4.3 million doctors, nurses, midwives and other related health workers. The shortages are most severe in some of the poorest countries, mainly in sub-Saharan Africa. Based on WHO figures, by 2015, Africa will need approximately 420,000 physicians. The natural tendency, however, as with any other field, is to gravitate towards the opportunities that offer better working conditions and better pay. This makes it extremely difficult to retain doctors in the places that are most afflicted with disease and human suffering, where doctors are needed the most. Reports indicate that Sri Lanka too does not meet the WHO recommendations for physicians per capita, with about 5 doctors for every 10,000 people. As a comparison, India's rate is 6 doctors, while a country like Somalia struggles to have even 1 doctor per 10,000 people, and a country like the United States has about 27. While many factors do play a role in this worldwide problem, national healthcare systems and governments also have a role to play. Sri Lanka, for example, suffered a brain drain in many fields because of the war. Now the government is trying to limit the brain drain of doctors to other countries by providing incentives. Through the Foreign Placement Coordination Centre, Sri Lankan physicians can now sign up to obtain foreign experience in return for coming back to working in Sri Lanka. A doctor will get a placement at a medical facility in England for 2 years. In return, a bond is signed that commits the doctor to work in Sri Lanka for 4 years for every 1 year spent in England. Several other strategies have been proposed to try to mitigate this global crisis. Providing quality education and maintaining strong institutions will help prepare the future medical workforce. Providing adequate compensation, good support systems, and promoting good supervision and lifelong learning will help improve the quality of medical work. And assuring safe working environments and promoting women for the medical profession could help reduce outward migration of health professionals. Reporting for Global Perspectives, I'm Mahina Bongso from the News First International.